Okay, if someone is incarcerated, now we're not talking about someone walking around passing out pills. Now we're talking about getting an injection, however infrequently. Can you get this reliably, first of all, from a clinician in an institution? And does it require an enormous change in the way this whole system works to administer this?
In correctional institutions that have nursing care, I think it is the choice treatment to go to, and I think it is more reliable that the patient will get their injection than getting a daily pill every day. For many issues in a correctional system with getting inmates to the nurse every day, it's problematic. There are court hearings, there are programs that inmates go to, whereas it's much less cumbersome on the system to get the inmate to the nurses and the psychiatrists for once a month or once every 3 months injection.
Educate me here, does every correctional facility have a healthcare professional, a nurse, a physician, someone who can do this?
Not daily, unfortunately, and that's where money comes in again. Many of the smaller correctional facilities only have, it's very difficult to find medical professionals that go there on a daily basis. And so especially when we're talking about the need to monitor side effects, it could be impactful to have a long-acting injection without monitoring.
Really important in this arena.
And actually, sometimes the availability of medical services is better in the correctional system than are in the community. Many cases that we see, patient got long-lasting while the patient was incarcerated, patient is discharged, the coverage, medical coverage they have do not cover for the right long-lasting antipsychotic. Big problem there.
But if you're telling me that you don't have somebody there every day, this again weighs in favor of one injection every 2 months. We'll come back and do it again, as opposed to a pill every day.
Because we know when they're treated effectively, some people say give it to them on the way out. No, we really need to start while they're in the facility. They're functioning better, they're able to follow the rules better, and they're more likely to get paroled or released earlier. Obviously a win-win for everyone.
And I'll tell you another complication. Sure. When we do send somebody off to a competency restoration facility, they're usually using a new generation, long-lasting medication, and then when they get returned to the jail has a different drug formulary because it's countywide, and then they change it. And then the person decompensates and we start all over again.
Does the left hand ever know what the
well,
right hand is?
remember,
so
seamless collaboration.
Right, it's a mess.
And in collaboration, if you have one of those smaller facilities that does not have daily nursing care, it's important to educate the correctional staff on what side effects look like.
Good luck with that too, because don't the staff, doesn't that turn over?
Well, it does, but I think because in the more smaller rural areas, a correctional institution is usually the primary place of employment. So it doesn't turn over as much. And so what I found is that when you engage the correctional staff, they're well in tune to what those side effects look like, and also educating them on when to engage a medical professional.
But just like law officers, unfortunately, the correctional officers are not often trained to deal with mentally ill. And you can tell how the day will go on the unit depending who your officers are. And those that are trained and able to deal with the mentally ill, you have a much better day.